Hi, welcome to Pennsylvania Newsmakers, and thanks for watching. Well, hospital-acquired infections have become the subject of a big debate in the state, and then we're going to hear from one of our health care policy experts, Dr. Stuart Shapiro, after we return.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, this whole subject of hospital-acquired infections has, become an interesting and I think important debate in the legislature and in other places around the state. We've called in Melissa Speck, who's the Director of Policy Development for the Hospital and Healthsystem Association of Pennsylvania, to get her perspective on this subject. It's an important subject. Melissa, welcome.
Thank you.
Well, look, let's talk a little bit. Let's just sort of, before we get into kind of what is being done by hospitals in particular, give me some perspective on this. First of all, when hospital-acquired infections covers a gamut of things that some of which don't even concern hospitals, or at least not initially. Go ahead, give us some background on this.
That's right, Terry. I think one of the important things, one of the misnomers out is it's all happening in the hospital. Right. I actually refer to it more of healthcare associated infections. It's actually a growing community problem. It's not something, it's certainly, there are infections that take place in the hospital, but there are lots of things happening outside the hospital, in nursing homes, on sports teams, in schools, in prisons, you name it. Folks are colonized with what we call MRSA, and can then come into the hospital.
That?
Methicillin, and again, not being the clinician, and my Latin is not the greatest, it's methicillin-resistant Staphylococcus aureus, MRSA for short.
Okay, so that's a condition. That's a condition.
That is one of the colonized bacteria that then contributes to and relates to or acts as the agent and kicks in the infection. It is an infection and a bacteria that is very much resistant to a lot of our antibiotics out there. So we just, it's a self-perpetuating problem. Yeah. But I think it's important that we recognize that it's not a hospital acquired all the time. It is a healthcare associated, and there are things that we need to be doing collectively.
So in other words, some people could come into a, let's just say I'm out, playing on a sports team, and I get some kind of a cut or an injury, and I'm treated in some way, and then a couple of days later it doesn't heal, and I may already have acquired some infection that may be resistant to some of the antibiotics. Let's just use that as an example. Come into the hospital treats me. They may say, well, you have to stay for some period of time, and then all of a sudden you got the infection, but you're in the hospital. Is that your point? I mean, one of the points you're trying to make.
I think my point is that we have folks that walk through our doors for treatment for separate types of activities, but they're already colonized with the infection, and due to the complexity of their illnesses, then they can actually, through the course of it and the activities that take place and the procedures done, it can then surface, but it didn't actually, wasn't the responsibility or didn't happen by the hospital.
So your bigger point is that these infections, well, they obviously can occur in hospitals, can occur in many other places, and it's difficult to know always where they began.
Absolutely. It's difficult to always confirm that it took place and was something that occurred in the hospital versus having...
I got it. That's a good point. I mean, I think we need to get that straight from the start. Now, let's talk a little bit about what's being done in the state to deal with it. As you know, this has been the subject of considerable discussion. Both, the governor's been on the program talking about it. The legislature has been dealing with this as well. Let's talk a little bit about what is being done at the state level, policy-wise, to sort of umbrella it, to bring it under some policy direction.
Well, I think, as I'm sure you're aware, the governor introduced the prescription for Pennsylvania, which I think is an excellent reflection of the commitment of the administration to take and start to address some of these growing public health problems. However, we can't, from a hospital provider community and healthcare provider community, we've been working on this issue for a long time. Infections have been out there for years and years and years. The media has obviously brought this onto the radar screen. There are obviously conversations because of the rising healthcare costs that have all raised the awareness of this particular issue. But there have been things that have been going on and being done by hospitals in particular for a long time. And in particular, of late, you've seen hospitals involved and engaged in a number of pretty high-profile, what I'll call campaigns or initiatives. Institute for Healthcare Improvement, the IHI,
right.
100,000 Lives campaign included components to address infections.
All right, we're going to go to a break. I want to talk about that and then see if we can see where all of this is going to go. I mean, I think what's important for the average consumer of healthcare out there is to understand, where all this is going to go, and so they can be, assured that, everything is being done to minimize. And we're going to talk about that and more with Melissa when we return.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by Pennsylvania Medical Society. Doctors and patients, preserve the relationship. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to Pennsylvania Newsmakers. We're talking with Melissa Speck from the Hospital and Health System Association about hospital-acquired infections. Become a big issue in the state of Pennsylvania. There's legislation that's been introduced to sort of deal with it. Let's talk about. I want to go back to the Institute for Healthcare Improvement and then move on to another subject quickly. Tell me what that initiative's about and why it matters.
Well, the Institute for Healthcare Improvement, the IHI, initiated a campaign to save 100,000 lives back in 2004. And a vast majority of our hospitals in Pennsylvania got on board with that campaign. And the goal was to raise awareness and ensure that hospitals were taking and implementing what I'll call best practices, best standards of care, to truly do what it said, save lives. And that campaign was very successful nationwide. Last report I saw, 122,000 lives were reportedly saved as a result of that campaign. And as it relates to healthcare-associated infections, that campaign in 2004 focused on surgical site infections, some of those areas in intensive care, ventilator-associated pneumonia, those kinds of things. Now, the new campaign that's following on the heels of the Saving 100,000 Lives is the Save 5 Million Lives, or reduce the rates of serious events and infections by 5 million.
All right, let's talk about another aspect of what hospitals are prepared to do in terms of dealing with this problem. In this legislation that's been proposed by Governor Rendell, there's a requirement that all healthcare facilities, I don't know if it's just hospitals or not, but all hospitals would be included in them, must have an infection control plan. What's that all about, and why do you think that's important?
Well, I think it's important because healthcare facilities, and that I think you're right, all healthcare facilities, so not only hospitals, but nursing homes and ambulatory surgical facilities, all types of facilities need to have in place a plan that addresses how they're going to deal with infections, and by dealing with, to prevent, to reduce, to minimize the effect of. So certainly, one of the things that hospitals are constantly doing is taking and addressing what they have in policies and procedures and what they have in plans, and keeping them up to date with the current standards of practice, such as what's issued by the Centers for Disease Control, et cetera, whatever the national standards are. It's an evolving document. It's not something that should be codified in a regulation or constrained by specific parameters in a piece of legislation. It needs to be a fluid document that is allowed to take and adopt.
Is there sort of, are there results that you can see demonstrated, you think, by supporting some nationally accepted standards? I mean, at the end of the day, I mean, this seems like it's hard to quantify. Maybe I'm wrong about this.
It's very hard. It's very hard. And, we were the first state in the nation that began to report hospital infections.
Right.
And the jury's still out. We have trouble, again, like we said earlier, confirming that the infection took place in the facility or in the hospital. And so to come up with a broad database and to take and know what your denominators are, the universe of infections, and be able to ascertain ratios and things like that, that's very, very complex.
Yeah, is this something, I mean, you know, we've talked about this before, you know, on a number of occasions in the past in our healthcare updates. Is this something that sort of the entire healthcare system, not just hospitals, needs to be involved with? I mean, what is an approach that's going to resolve this? I mean, you talked about all the parts. Is this something where virtually everybody that delivers healthcare has to get on board with, and there has to be some general consensus about how to proceed?
Absolutely. Absolutely. The hospitals are only one component of it. You need strong leadership, which again, you know, we see that taking place and starting to pan out in Pennsylvania, but being prescriptive, putting a designation of here's how you're going to start at point A and get to point B doesn't necessarily work, because the healthcare environment, depending on which area you're looking at, whether it's in the hospital, in the independent practitioner, private physician's office, in the nursing home, everybody plays a different role.
Right.
And therefore, it's absolutely imperative that we all do come together and work collaboratively to address it. We have nursing home patients that may be coming into the facility with a urinary tract infection, and when they're transferred to the hospital, if the hospital's not made aware of that infection, that underlying infection, it takes and becomes more complex and surfaces as a growing
I mean,
issue.
It sort of makes sense that it's something that requires the, you know, being addressed by the whole medical or the whole healthcare system. All right, Melissa, thanks for the great update. All right, Dr. Stuart Shapiro, one of our healthcare policy experts, is on board next. Stay with us. We'll see you after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Credit Union Association, Pennsylvania Credit Unions, where people are worth more than money, and by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Joining me now, as often is the case, is Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Health Care Association. He's in for a healthcare update. We bring him in, obviously, to talk about a variety of healthcare issues. We're going to talk a little bit about a problem that's growing. It's the expansion of Medicaid and what impact that has, particularly on nursing home facilities. Welcome.
Hi, Terry. Nice to see you again.
It's always great to have you on. Look, you're the real expert on this. Let's talk a bit about, before we get into the nursing home, let's talk about Medicaid. Expanding eligibility, that seems to be the order of the day. The governor looks like he's going to try to go there. That means more people who are poorer, less well off in terms of their health care. Give us your perspective on that.
Well, I think you have to look at this in a number of ways. Let's start with the federal government. President Bush has proposed major cuts in both Medicare and Medicaid.
Right.
At the same time that he's doing that, Governor Rendell, who's quite bright and quite sympathetic to the needs of those in Pennsylvania who don't have health care, he's proposing expansions in Medicaid. And the question really is, how are you going to pay for it? Not whether it's the right policy.
I think almost everybody agrees it's the right policy. In the polls that we've done, the voters of the state want health care for, for virtually everyone.
Correct. The issue is where you're going to find the money.
That's correct.
Unfortunately, what the governor has done in his budget is he's played with the various pieces and attempted to rob Peter to pay Paul.
Right.
And that simply isn't going to work, because it comes back to affect the most vulnerable in our society, often those who are in our nursing homes.
Okay, now one of the things that we've talked about over the years that you've been on the program, and I want to give you a chance to flesh this out again, is sort of the approach, and then we're going to get to the specifics of what you think ought to happen with the budget. But before we do that, talk a little bit about home-based care versus nursing home. You're the expert on this. What, kind of the balance. I noticed that home care, taking care of patients in the homes has really gone up dramatically in the last couple of years, as opposed to nursing home care, which is sort of fairly stable. Is that correct?
In fact, I brought some charts on that, which I think you have right here. They're pretty simple. The bottom line shows what's happened to those receiving home and community-based care under Medicaid. And you can see that it's virtually doubled between 2002 to where we are today, from 17,000 to 35,000. The top line is the number of people in nursing homes under Medicaid, and that line's been flat. And the middle line is the average daily census of those under Medicaid in nursing homes. The theory has been, if you provide services at home, you'll keep people out of nursing homes. Fact is, that hasn't happened. What that graph really shows you is that the number of people who are now getting Medicaid has gone up. Many of those people would have received services at home. Their families would have provided it. So what we've done is we've created a new government program under the guise that it would prevent people from going into nursing homes, but it hasn't done that. So we've added millions and millions and millions of dollars to the state budget, plus we've taken some away from the nursing homes when they need those funds to provide the care.
Now, you've talked about this before. I mean, there's obviously an appropriate, I mean, it seems to me there's sort of a, and you've talked about this, there's an appropriate time and place for folks to take care of, you know, their loved ones at home.
Absolutely.
But you know where this all goes. At some point, if the medical condition of the person deteriorates, then
they have to be in a nursing home, and they ought to be able to receive high-quality care that's paid for under Medicaid. And the way the administration's proposal is, it's taking money from the nursing homes under the guise that it's going to keep people out of nursing homes, which it doesn't. Nursing homes continue to have their cost increasing at 5–6% a year, but yet the governor has proposed only a 1% increase in the budget. And pretty soon, nursing homes who are delivering quality care, and they'll always continue to deliver quality care, are going to have to start to cut back on how often the sheets can be changed, or when the person's hair can be done. We're talking about quality of life for our greatest generation, and that's why we either have to decide as a Commonwealth to have a new set of programs with new entitlements, but we can't abandon our current programs.
All right, we're talking with Dr. Stuart Shapiro about this very important issue of nursing homes and the relationship between nursing homes and home-based care and the needs of the elderly, health care needs of the elderly in the state. We'll continue with that discussion after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Health Care Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Builders Association, building today for a better tomorrow. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to Pennsylvania Newsmakers with Dr. Stuart Shapiro, one of our healthcare policy experts. We call in from time to time to chat about the different healthcare issues. Let's talk a little bit about, you know, we've done a lot of programs on the governor's budget, you know, different recommendations made by the governor's recommendations, different organizations reacting to them. Your increase of 1% is less than the average that the governor's recommended for his overall increase, which is something like 3.6 or 3.7%.
He has suggested for hospitals that they get a 2%.
Right.
And for home and community-based services, that they get a 3%.
Yeah.
What he's proposed for nursing homes is 1%.
Yeah.
And he's done that so he can pay for other programs.
Yeah, but let me interrupt you here. But, you know, that's less than his average for everybody, and everybody understands that health care costs still are rising above inflation.
Well, and for nursing homes, it's especially important because the people that are coming in are sicker and sicker and sicker. Yeah. And it's very important that the legislature not abandon the elderly in their district. Nursing homes are providing care every day, 24/7, and it's very important that the inflationary increases be covered. Yeah, and they're running close to 5%. Yeah. But
and a lot of the costs are you don't have anything to say about, right? They're just
virtually nothing.
I mean, they are what they are.
The wages, it's a tough job. Wages are going up 4 or 5% a year. Cost of food is going up 4 or 5% a year.
Medical procedures
are going up. Yeah. And it's not unreasonable to say a cost of living increase should be for our most vulnerable citizens 4% a year.
Let me ask you another question that's pretty important. You know, there is a range of services, healthcare services, that could be provided between home-based care on the one hand and nursing homes on the other, which I think is, you refer to as assisted living.
Correct. And
explain why you think that category of services is something that needs legislation. First of all, why is it important, and what should the state do about it?
38 out of our 50 states today have a category called assisted living. We don't in Pennsylvania. There's people calling themselves assisted living facilities, but there's no standard set. There needs to be a clearly defined set of standards that say people who are nursing home eligible, but don't need intensive 24-hour-a-day services could be cared for in a well-regulated new category called assisted living. Right now that doesn't exist. This would ultimately save the Commonwealth some money, and would help give consumers the choice that they want. Other states have it. Senator Vance has introduced, who's from this area.
Pat Vance from Cumberland County.
Who's a terrific legislator, has introduced legislation in the Senate. It has 33 sponsors. That's 33 out of 50. And we're very hopeful that that legislation will pass. She knows this field. She's a nurse. She wrote the legislation.
Where in this category, where would the people actually live?
They'd live
at home?
No, they'd live in a category called assisted living. And it would be a facility, a housing facility, that didn't look like a nursing home, and it didn't look like a hospital, but was a much more home-like environment, but that it was well-regulated and medical services were provided there that are needed, but not on a 24-hour basis, so that people could live in a setting that would really provide the services they need.
Yeah, before we let you go, we have another chart here that I think is pretty important. It has to do with demographics in the state. We'll let the camera pick it up and say something about this.
You know, it's interesting. Most people think that the problems in Pennsylvania are really severe today because the over 65 population has been increasing. The fact is, it hasn't. As you can see on the chart, between 1995 and 2005, the population of over 65 went down. It has started to creep back up. It's almost at the level back in 1995, and then afterwards it's going to skyrocket.
So it goes up in the out years pretty heavily and continues to go up.
And that's because during the war years, just before the baby boomers, birth rates went down. But the problems we're going to have is very important that we solve these today.
Great update. Got to interrupt you. We're out of here. We'll see you next week for another edition of Pennsylvania News.